So for scenario 3 with Mr. D who has just had a hip surgery on his left hip and has a bandage on it, and he has an IV in his right arm and a Foley catheter. For getting up into a chair, you would obviously make sure this is what the doctor ordered, but some supplies that you're going to need to do and procedures before. So when you're beginning the morning care, you would perform hand hygiene as normal. If there's any precautions you need to take, as like such gloves you might need if you're changing the resident, or making sure you have a clean gown or clean clothes for him, and normal things like when you're doing morning care, you would have the washcloths if he can't get into the shower since he just had the surgery. If the bandage couldn't get wet and you're giving him a bed bath or a partial bath, you would need other equipment like an emesis basin, washcloths, the soap, towels, bed protectors, and making sure that his bed is staying clean. So if you need to change his bed because it gets wet or it's just time to clean his sheets, you're going to need all of the proper equipment for a bed. So you need the bed protector, you need the lift sheet, the sheets, the flat sheets, the top sheet, and his comforter. So pre-procedure requirements as you're beginning your morning care, you would do your pre-procedure care. So you would introduce yourself, tell them what you're going to be doing, explain, making sure that that's the right person you'll be treating today and helping, not treating, but caring for. And you would have, you make sure to do your hand hygiene then, and you would be like, okay, Mr. D, we're going to get you up and change and get ready for the day. And since this is in the morning, you'd be doing oral care. Depending on his time to bathe, then if you're doing this before breakfast, you would bathe him, put his clean clothes on or gown, and you would make sure that you're watching out for his catheter and his IV. And you're also making sure that his surgical site is how it's supposed to be, so the bandage is still clean. If not, reporting it to the nurse, making sure the catheter and the IV are clean as well. And if the catheter is full, the drainage bag, then you're draining it and cleaning, making sure you're sticking to what's in your scope of practice. And making sure that if you are changing him and you're respecting his privacy or even bathing him, either closing the curtains or closing the doors, and making sure that you're explaining to him what you're doing when you're doing it and what you're about to be doing, so he's not caught off guard. Make sure that since he is getting up, you're going to have his TED hose put on before he gets up to prevent blood clots and help with circulation in his legs. And you're also going to need your gait belt. So after you do his morning care and you change his gown or clothes, depending on what he's wearing and what he can wear, you would, when you're changing his clothes, you would start on his left side by taking off his gown on his left side, because his right arm is the one with the IV in it. So you would take it off on his left side, and then you feed the IV bag through the sleeve and take the tubes through the sleeve as well, making sure not to pull it too hard and yank it so he's still comfortable. And then you would take the sleeve off. When putting it back on, you would start on his right side, which is the affected side with the IV. And obviously you put it on after you clean him, but still make sure he has privacy. So if you have a bath blanket over him, so he's warm and containing his privacy, then you put the sleeve back on, feeding the IV through again into the sleeve and pulling it all the way through, hanging it back up on the pole, and putting the gown on and making sure he's fully covered and comfortable. And then when you are transferring him, you should be concerned about making sure that you have the pole his IV pull close enough so you're not pulling it when you are transferring him to a chair. Same thing with the catheter, making sure that the bag isn't far away so it's pulling out, and you're also making sure that you're not injuring him more, especially on his hip. So this would be a 2-person transfer with a surgery, and as a CNA you would need your partner and your supervisor. So for us, we would need our CNA and then our partner, and you would make sure to stand closer to his left side. But when you're getting him up off the bed, you give him the time to dangle with his feet over the side of the bed when he sits up to make sure that he doesn't get up too fast and he's not dizzy, making sure that he can sit like that properly from the doctor's orders because of his hip and the surgery he just had on it. Again, making sure you're not pulling or tugging any wires, cords, tubing, and you would have the gait belt over clothes, not on skin, to prevent skin breakdown or rashes and bruising and pain. And when you are moving him to the chair, you make sure you stand more on his affected side, which would be his left, if he's allowed to start walking. And if he's not, and you're supposed to be using a mechanical lift, you can assist with that, but you cannot use it yourself because that's not in our scope of practice. So his affected side is his left side, as I mentioned earlier. And post-procedure requirements before you leave Mr. D in his chair is making sure he's comfortable, making sure he's sitting properly according to what surgery he just had and what the doctor orders. And if it hurts, that you help accommodate with the pain, like doing his exercises if you're allowed to do so, and also making sure that nothing is on his hip and hurting his hip. So the chair would be comfortable enough for him in the proper position. And you have to make sure to reposition him every 1 to 2 hours to prevent pressure ulcers, even if it is in his bed or his chair. And you should reposition him about every 1 to 2 hours. And for post-surgery, making sure he's doing his exercises and that he is being moved every 1 to 2 hours. And what you would document with this is, again, word for word, his pain level using a pain scale, and anything else that he mentions, that you write down word for word what he says, even if it's not related to the surgery or his IV or catheter. If his head is hurting, you make sure you document exactly and tell the nurse exactly what he says, and you also write down what you see, but not what you think happened. And that is all for resident 3. Of course, after you leave the room, you take off your PPE that you're wearing properly, making sure you're changing it throughout his care accordingly. If they're visibly soiled, you change them and perform hand hygiene. And then again, after you remove your gloves when you're leaving his room, you perform hand hygiene again, and making sure that not only is he safe and okay to stay in his room, but that you've completed all your tasks, and ask him if he needs any help with anything else, anything you can get him, and just make sure he's comfortable and safe, and that you've documented everything you've seen and he said. And that's it for scenario 3.